Hello, good evening, and welcome back to Rural Health Matters. I'm Dr. Jeff Gold, and we are so pleased to have you with us tonight. This evening, we're going to focus on measles, a disease that was once thought to be nearly eliminated in the United States, is now making a troubling comeback with outbreaks that have been reported in multiple states and multiple communities, all raising concerns about its spread, its severity, and what we can do to protect ourselves. Later in our broadcast tonight, we'll be once more joined by one of my friends and colleagues, Dr. Mark Rupp. Dr. Rupp is an infectious diseases expert who has helped guide our nation through major public health challenges. And we'll talk with Dr. Rupp about why measles is reemerging and what this means for public health. But first, as we always do, let's look at the latest trends and latest numbers, and as we do, let's start off with a brief update on COVID. And I'm very pleased to tell you tonight that all of the trends in summary are moving in the right direction. Test positivity is down from 4.6 to 4.3% as an early indicator. Emergency department visits are once more down and are staying well under 1% of all emergency room visits. Hospitalizations have dropped down from 2.9 to 2.7 per 100,000. And indeed, the death rate has not changed much. It's still 1.1% of all of the recorded deaths in the U.S. But as you know, of course, the death rate and even the hospitalization rate are lagging indicators. And hopefully, as these numbers fall, so will those into the future. When we look at the COVID variant distribution by type using the nowcast forecasting model, you can see, just as we predicted last week, the LP variant of Omicron subtype is now representing about 42% of all of the determinations from serotyping this virus, and now surpasses all of the XEC variants, which are a full 10% lower. Good news, of course, is that this virus strain, the LP strain of the Omicron subtype, is just as amenable to our vaccines, but unfortunately is more transmissible and is outcompeting all of the others. And the prediction is that until we see something else on the horizon, this is going to be the dominant strain across the United States. And given the fact that the overall numbers are falling, the more cases we have, the more mutation we have, the higher chance of getting a more transmissible variant. So if the trends continue in this direction, we're likely going to see the LP subtype lineage continue to decrease. Case fatality rates, going back to the very beginning of the pandemic, continue to fall. And if we just look at the last year of case fatality rates, you can see that we're almost at approximately half of the number of deaths per week due to COVID than we were a year ago. Now, hopefully that trend will be sustained. We've come down a good deal as to where we were in late January and early February, and those numbers hopefully will continue to fall. And that is a pretty supported, optimistic statement. Here's a year's worth of wastewater data that gives us our national trends, our Midwest, our Northeast, our Western, and our Southeast part of the United States. And as you can see, the Midwest sort of stays at the top, well above the national levels. The Northeast and the far West are down at the bottom. If we look at the last 45 days of wastewater trends across the United States, whereas last week it was a pretty fair statement that things were stable and neither going up nor going down. This week, the trends through February 22nd clearly show that the national level is in the moderate, the central part of the moderate range. Last week, it was just at the border between moderate and high. And even in the Midwest, our part of the country here, which was in the high range for a reasonably long period of time over the last 45 days, has now actually fallen to moderate. And of course, the wastewater numbers are a very solid predictor future caseload and hospitalizations and even deaths. So again, all very favorable data on the COVID front this week. So let's shift gears and let's talk about influenza, and we always do, just a snapshot on where we are in high-path avian influenza or high-path flu. We're up to about 166 million poultry confirmed, which is somewhat up over last week, and this is through February 28th, last week. Dairy herds, 976, somewhat up, and the same 16, now 17 states with outbreaks in confirmed dairy cattle herds. So what used to be California, California, California is now somewhat variable, and we see here recently reported dairy cattle in Nevada, in California, in Arizona, California, Nevada. Again, this is information over the last week. So it certainly appears that the southwestern part of our country, at least where the testing and reporting is coming from in milking dairy cattle, seems to be where we are identifying most of the caseloads. 70 confirmed human cases, no change over last week, 41 of those associated with infected dairy cattle, 24 associated with poultry and culling operations, and the other 5 are miscellaneous or undiagnosed, etc. We still are reporting only 1 human death, and that's the case we reported several weeks ago, over a month ago in Louisiana, and just a very, very small handful of hospitalizations. So low number of human cases, low severity, no evidence at this time of human-to-human spread. When we look at seasonal influenza, this is a map of the United States as of last week, looking at the hotspots, if you will, of seasonal flu. You see there's quite a bit in the Northeast, a good bit in the Mid-Atlantic, the Great Lakes region, the Pacific Northwest, and in the far west. However, the trend analysis for outpatient respiratory illness diagnosis, the FluServe-Net testing, the activity map, is actually showing favorable trends. That is to say, it is getting better. The mortality rates are pretty stable. We're at 2.8% now, which is 1.5 times higher, almost twice as high as the COVID mortality rates, but stable and not raising anymore. And this is really important because for a very long time we were seeing flu A and flu B rates continue to rise across our country, result in more hospitalization, and unfortunately, tragically, result in even more death. If you look at the maps, the one on your left is last week's flu map. Again, the brighter colors, your purple, your dark reds, your bright reds, your dark browns, those are the very high density part of the country. The yellows and greens are your minimal to low. So this compares us over about a 30-day period. The map on the left side of the screen is last week, and the map on the right side of the screen is about a month ago. And you can see quite a difference, more intensity in the Midwest and in the upper northwest part of the country, but less so in the Great Lakes region and somewhat less so in the southeast. So still a lot of flu in certain parts of the country, and so warning about staying in contact with individuals who are sick. If you are sick, please don't go to work and don't go to school or events, concerts, athletic events, etc. And again, it's never too late to get flu vaccine, particularly for those of you who are in the higher risk age groups. So the story tonight, and what we're going to talk with Dr. Mark Rupp about in just a very few minutes, is measles. Now, measles has been making the headlines, particularly in Texas and other parts of the country. And this was a headline that came through the Associated Press from Lubbock, Texas, in, of course, western Texas. And this reported on a child who was not vaccinated who died as part of a large measles outbreak in rural West Texas. in the core of the ranching communities of Texas. And the report goes on to say this is the first confirmed United States death from measles since 2015, 10 years. The report goes on to say that this school-aged child had been hospitalized and died last Tuesday night, and certainly our thoughts and prayers go out to their family, loved ones, classmates, etc. And this is the largest outbreak in 30 years, certainly in this part of the country, since it began about a month ago. At that time, there were an estimated or confirmed 124 cases that erupted in 9 different counties in Texas. And the Texas Department of Health Services and the Lubbock health officials confirmed the deaths to the Associated Press. So this was a confirmed flu-related death. So let's talk a little bit more about what measles is, where it comes from, what we know about the spread. Then we'll have an opportunity to ask Dr. Rupp his thoughts and the best advice for prevention and what this means given the changes. Well, certainly measles is one of the most highly contagious diseases that can lead to serious complications. It is unquestionably one of the highest spreading factors. You may remember in the early days of COVID, we talked about the R0 or R0 factor. Measles is the one that it's always been compared to because of its incredible transmission patterns. Symptoms usually begin a full week to 14 days after infection. So that is to say, you or I or one of our kiddos could be exposed to measles, and it would be a good week to 2 weeks before they had some of their earliest symptoms. And as we know, this can be dangerous, especially for babies, infants, and very young children. And so I have a couple of comparison graphics for you here to look at. On the left side of your screen, you see the total number of measles cases for the entire year in 2024, 285 cases. This year, through the end of February, we're up to 164 cases. So we're on a really, really rapid trend. Now, point being, 285 cases last year is not zero. It is higher than 2023 due to some outbreaks. But nonetheless, that's a year's worth of anecdotal experience. Now, last year, of that 285, 42% were under 5 years of age. Thus far this year, that's 34%. Last year, almost a third, 27%, were over 20 years of age. This year, it's about half of that number. It's about 18%. Last year, of those 285 cases, 89%, almost 9 out of 10, were not vaccinated or vaccine status unknown. And this year, thus far, that number is 95%. So there's clearly a very tight correlation between the number of cases in all age groups and the vaccination status. Same type of comparison here for hospitalization. Last year, 40% of the 285 cases, 114 patients, were hospitalized in the United States. This year thus far, and it's a little early to tell because these outbreaks are ongoing, and so this is a changing number, 32 or 20% of the 164 were hospitalized. Interestingly, though, last year, 52 or about half of the hospitalization occurred in kiddos under 5 years of age, whereas this year it's just under a third at 29%. But again, this is very, very preliminary data. Last year, about 40%, just under that, 39% of hospitalization occurred in individuals more than 20 years of age that we would consider adults. This year, thus far, the number is far lower. It's less than half of that. It's about 17%. Probably no change in the virus itself or the infectivity, but probably a lot of change in the early nature of the reporting. You know, I found these two graphics to be very interesting. The one on the left looks at the total number of reported measles cases in the United States since 1962 through the end of 2023. And what you see, we had about 500,000 or 500,000 reported cases of measles until 1963, when the first vaccine was licensed in this country. And then we saw a very rapid decline over the next several years until 1989, when the second viral vaccine dose was licensed. And then several years after that, in the year 2000, that's when the virus infection with measles was declared, quote, eliminated, unquote. Now, it has never gone to absolute zero, but it has been in the very, very, very low numbers. Now, if you look at the chart on your right, that's titled Weekly Measles Cases by the onset of rash, and that's from 2023 through February 27th, last week of 2025, I think you would agree that there's an absolutely unmistakable trend that we saw a peak in mid-2024, very isolated. It never came back down to baseline. And then over the last several weeks, particularly with these outbreaks in Texas and several counties and geographic distributions, and now in some surrounding states such as New Mexico, we are seeing a very significant change in the number of cases. Now, we're talking, per week, 40 cases, 50 cases, almost as high as 60 cases per week. That level, although it may seem like a very small number, is much, much more than we've seen in this very short period of time. This is a look geographically, year over year. Again, on the left side of your screen, you're seeing the total number of measles cases in the United States by state. So pretty high in the Great Lakes region and somewhat in Oregon, a little bit in California, maybe a tinge higher in Florida. This year, on the right side of your screen, a rather different story. Concentrated in Texas, with much less in the West Coast and almost nothing in the Northeast, and really nothing thus far reportable in the Great Lakes region. When we look at the same two maps for hospitalization, they mirror that completely. Now, the early complications of measles infection are pretty well known. And overall, thus far, about 1 in 5 or 20% of the unvaccinated people in the U.S. who get measles end up hospitalized. 1 out of 20 children with measles will get measles pneumonia, the most common cause of death for measles in young children, end up on a ventilator, hospitalized, and unfortunately don't recover it. Measles encephalitis, or inflammation of the brain and swelling of the brain, that's much rarer. That occurs in 1 child in about every 1,000 who get measles. This leads to seizures, can lead to deafness, and severe intellectual disability. Death rates, fortunately, are low, but not zero, as we just learned about this 1 child in the Lubbock area who was hospitalized and died. But about 1 to 3 out of every 1,000 children who become infected with measles will die from respiratory or neurologic complications. And again, if there's any issues surrounding pregnancy, if many of you audience are pregnant or thinking of becoming pregnant, this is a real call to action for MMR, measles, mumps, and rubella vaccine, because prematurity and low birth weight, which are both very serious lifelong impact on newborns and their families, are clearly significantly raised by measles infection during pregnancy. And then, of course, unfortunately, there are long-term complications of measles, and probably the most dreaded one is something referred to as SSPE. The technical term is subacute sclerosing panencephalitis. It is a rare and unfortunately fatal disease of the nervous system, and it results from a measles virus infection acquired significantly earlier in life, typically 7 to 10 years after the measles infection. This SSPE presents itself. Now, this was essentially eliminated in the year 2000 with almost unheard of rare occurrences. But there is no question, given the frequency of measles infection that are currently rising, there is a concern. And this report from the Centers for Disease Control and Prevention goes on to say among people who contracted measles during the resurgence in the United States in 1989 to 1981, 7 to 11 out of every 100,000 went on a decade later to develop this panencephalitis, which unfortunately turns out to be nearly 100% fatal. And it also turns out that for those kiddos that were infected under the age of 2 years, the incidence appeared to be higher. So again, a decade after the infection, the younger you are, the higher the incidence, and unfortunately, a very serious long-term complication. So we'll talk more about prevention and other things when we bring Dr. Rupp into the conversation in just a few minutes. But I did want to share with you one or two worldwide updates that certainly caught my attention. This was a report from the Democratic Republic of Congo, and they reported 2 clusters of unknown illness causing 50 deaths, and as of mid-February, 2 weeks ago, causing 431 confirmed cases. Now, this there is no diagnosis yet in these remote villages in different health zones in the DRC. However, the report that this appeared to originate from a small group of children that were eating meat created from bats that were captured in bat caves certainly raises the question, as we've talked an awful lot about highly lethal hemorrhagic viruses that have presented as a result of harbors of these viruses in bats, particularly in fruit bats in different parts of the developing world. So more to come on this. I'm sure that over time the World Health Organization and the Africa CDC and the Health Organization of the Democratic Republic of Congo will continue to refine this. But the rapid rate over the last 2 weeks of the progression of this in 2 different clusters of illness certainly caught my attention. I thought I would share it with you tonight. And then before we answer some of your questions, I thought I would answer a question that came in last week from one of our callers that suggested that they had heard that some of these mRNA vaccine boosters that were delivered in large numbers to individuals with impaired immune systems may be responsible for further impairment of their immune system, meaning lowering of antibody levels and other acute phase reactants that could make their immune system worse. So I did a bit of homework and actually found this reported on the Centers for Disease Control and Prevention website as well. And what they say, and this is a direct quote from them, over the last 24 months, there's been growing evidence of a correlation of mRNA COVID-19 boosters with increased prevalence of infection and other pathologies. Now, they analyzed this and found that this was unique to older individuals and individuals with impaired immune systems who have received multiple booster doses of the vaccine. They go on to say that they're continuing to study this and look for some of the other causes that may be in place, such as an underlying very specific immune complex insufficiency in these individuals. But I did want to share this because the caller last week asked a really good question, and I wanted to be sure that we fully answered it with whatever the most recent reliable information was. Now, obviously, this is going to continue to change, but no question, the COVID vaccines and others are highly effective. They clearly prevented a tremendous amount of morbidity and mortality in the United States. But how many doses, how many boosters, which age group, what other comorbidities may be prominent here needs to be determined. It just makes the point of how powerful the science is when you can analyze large groups of individuals and look for changes. So, in summary, what do we need to know in rural America tonight? COVID wastewater levels, cases, and hospitalizations are still presenting in rural and urban communities, but slowly declining. The good news is the wastewater numbers are going down across the country. The good news is hospitalization is going down and test positivity is going down. So this week, all good news on COVID. The updates on high-path avian flu remains, in the CDC's words, low risk to humans, although we continue to see spread to wild birds, poultry, and dairy cattle, and we have a number of rare human infections that are ongoing, but the severity of those infections, hospitalization, and death rates really have not changed week over week. I did report to you the unknown disease that has been identified as a hemorrhagic fever in the DRC, and that it continues to spread with now more than 50 reported deaths and over 400 confirmed cases. More on that to come in the future. And then finally, the subject of our flow tonight is going to be the measles outbreak that continues to spread with the recently reported death of a tragic child's loss in western Texas. Now, if there's any part of our broadcast tonight or in the past that you missed, please know you can always go to our website. If you scan this QR code, you have access to all of our previous shows. And of course, this show as well will be up in a YouTube format and available for you. Now, I understand we do have one of our first callers online. And so before we go to break, if it's okay with the team in Nashville, if you want to share that call, we'd be very pleased to try to answer it.
I just watched your show on the phone, and I'm working with the home health is working with me on my balance issue. It's a disease. It's a symptom. It's not Parkinson's. It's not dementia. It's called Parkinsonism. It's the symptoms of a Parkinson's. And I just wonder, is there any other symptoms identified with the disease, with the Parkinsonism?
Well, thank you so much for calling, and I certainly feel badly for you. Any loss of balance really causes instability in our gait, and we have to be really careful about slip and fall and that sort of thing. And we've talked a lot about that at home, particularly in the bathroom, on a bath mat, and things of that nature. But in specific answer to your question tonight, there are so many different types of neurologic disease, spinal cord disease, even inner ear problems that can cause serious balance issues. Seeing a neurologist, particularly a neurologist that specializes in what we call movement disorders, would certainly be in your best interest. And as we like to say, all healthcare is local. Many of these are treatable with either anti-inflammatory agents, or if they're caused by an infection, by an antiviral or an antibacterial drug, which can be extremely useful. And I couldn't agree more that physical therapy to restore balance and muscle strength in the muscle groups of your back and of your legs, and particularly core muscle strength, is really important. So thank you for calling. And that, of course, reminds us that our phone lines are open. So if you have a question tonight on any subject we've discussed or any subject about rural health, please call us at 877-731-6733. And when we come back, we'll be joined by Dr. Mark Rupp, who will talk to us a lot about measles and other infectious disease. Thanks for being with us. We'll be back with you in just a minute or two.
If joint pain from aging is slowing you down, Omega XL can help you get back in the saddle, just like it did for John Walsh.
Today I'm here at my ranch exercising some of my polo ponies. Got to be really fit to ride these horses. So as you get older, it gets tougher. I was starting to suffer some of that business, and then I ran into somebody who said, look, you should try Omega XL, and look what it's done. I feel better than I felt in the last 30 years.
I'm Reve Walsh. I'm John Walsh's wife. I ride fox hunters, and sometimes I'm in the saddle for 3-5 hours at a time. A lot of work out here.
I wouldn't have been able to do this. Muck a stall, throw hay, do all the things that needs to be done on a ranch a couple years ago. But Omega XL gave me the ability to get back in the saddle. It works great.
Once you try it, you don't want to be without it. It makes a huge difference.
It does. Take it every single day, and you know, there's a benefit. It's made you a lot nicer to me.
If you've been living with pain, it's time to get this special offer, the Omega XL, the joint health supplement that millions have trusted for more than 20 years. Omega XL, it's sourced from the green-lipped mussel. Exclusively found in the pristine waters of New Zealand, some of the cleanest waters on Earth. Omega XL, it's natural, drug-free, and it's backed by more than 40 years of clinical research that show it really works. Try Omega XL today. Pick up your phone and call the number at the bottom of your screen right now for a special offer. Buy one, get two free. 2 bottles of Omega XL plus Vitamin XL D3, a value of more than $100. But call today and you pay only $39.95. That's a savings of more than 60%. Plus, it's backed by our 60-day money-back guarantee.
Try it. You got nothing to lose.
Call or go online right now to get this special offer. 2 bottles of Omega XL plus Vitamin XL D3 for only $39.95. Call now.
Welcome back to Rural Health Matters. I'm Dr. Jeff Gold, and thank you so much for being with us this evening. It's now my privilege to welcome our very special guest, Dr. Mark Rupp. Dr. Rupp, who's been with us many times during the COVID pandemic and on so many other subjects, is a bona fide, true infectious disease expert. He's somebody who's been in the front lines in the fight against Ebola virus disease, COVID, and so much more. He's the former chief of the University of Nebraska Medical Center's Division of Infectious Diseases and has been a leading voice in explaining COVID-19, its effects to Americans. And you've seen him on CNN, Fox News, and of course, right here on Rural Health Matters. And tonight, we have the privilege of talking to him about the recent outbreaks of measles and other recent news around the world. So I want to thank you, Mark, so much for joining us tonight, and welcome back. And before we get into our discussion about measles, I think we have a caller on the line. And so if we can take that call, I want to make sure that we answer as many questions from our audience as possible. Did we drop the caller? Perhaps we did. Perhaps we did. Well, in that case, I'm sure he'll call back or she'll call back. But Mark, before we talk about measles or anything else, our audience is always interested in our guests' career journeys. Was there a day that you decided you wanted to be a physician, and if so, how? And how did you develop an interest in infectious diseases? And, specifically, it's worth unpacking. How did you develop an interest in academic healthcare? Because there's a very big difference between what your career has looked like compared to all the hardworking clinicians that most of those of us in rural America deal with on a daily basis.
Yeah, thank you, Dr. Gold, and it's great to join you and the audience again this evening on the Rural Health Matters program. I went to school initially and actually trained to be an engineer, a chemical engineer. And it was during my engineering education that, I decided it was something I could do, but I just wasn't something that captured my imagination. I had always been very interested in the life sciences, and so I kind of naturally gravitated towards medicine, ended up going to medical school, and initially thought I wanted to be a surgeon, like you. And then over time decided that I wanted to go into internal medicine, and I'd always really been fascinated by microbiology, bacteria, et cetera, and gravitated towards infectious diseases. And then I did make a decision during my fellowship training that I wanted to stay in academics because I did want to pursue things just a little bit more aggressively as far as the knowledge base and doing some lab research. And then I also thought that perhaps I could actually expand my reach by being in academics and doing those studies and publishing our results and perhaps influencing people on a broader basis rather than on a one-on-one basis. So that's kind of a thumbnail sketch of who I am and how I got here.
Well, it's a great thumbnail sketch, Mark, because, as I'm sure you know, but our audience may not know, that my undergraduate degree is also in engineering. And I just decided to stick with the surgery thing, and it worked out okay for me after many different years. We have Michael back from Nevada. Michael, please go ahead with your question, and thank you for calling us.
Oh, yes, thank you very much. I'm calling from Las Vegas. I'm not a political person. I don't want to get political, but I just have a simple question. Do you think the rising cases and measles has anything to do with the rising cases in illegal immigration? Thank you very much.
Well, thank you for calling, Michael, and I certainly appreciate your question. And the best answer I have for you is I really don't know, but I'm guessing that there is information on the demographics of some of these populations. Certainly, there is a direct correlation between immune status of a community and the spread of measles. And we'll talk a little bit about that with Dr. Rupp in just a minute. But this gets down to the fundamental question of what is the herd immunity in that community at any given time. You know, what percentage of K-12 school kids, particularly in the lower grades, preschool kids are immunized, and what the spread rates of the disease is going to be. So it's almost a question of not only do you strike a match, so to speak, in that community, but how much dry kindling do you have to get the outbreak to continue to progress. So on that subject, Dr. Rupp, let's talk a little bit about measles. You know, I'm sure you heard in the first block of the show, I provided some updates on, you know, historically where we've been when we really thought we eliminated the disease. And let's talk a little bit about the last couple of years and what we've seen, and what do you think the significance of that is?
Yeah, well, measles is a disease that we've known about for an awfully long time. You know, it's thought that this actually evolved from a disease in cattle called rinderpest. And, you know, it's been with us for at least 1,000 years. Some of the best descriptions of it are actually from about 900 with a Persian physician. And, you know, before we had vaccination, this was something that was extremely widespread in human populations. It is truly credited with being just absolutely decimating for the Native American population when it was imported into the New World with European discovery of the Americas. And really, since that time, you know, we've not had any specific therapy for measles. All we could do, thankfully, when the 1950s, 60s came along and we developed the vaccine, we had a really, really powerful tool to fight measles. And it was so successful, as you mentioned in your preamble, we got to the place in the United States where we essentially eliminated the disease. And then, as the caller's question intimated, we've had, you know, relatively rare imports of the disease into the United States, sometimes from other countries where they don't have as widespread vaccination. And because measles is so infectious, it's probably the most contagious virus that we know of. And because of that, if essentially everybody isn't immunized, it will find those rare people who either haven't been immunized or occasionally, if you've been immunized and haven't responded to the vaccine, you'll get measles. And this is just an amazingly infectious virus. Also, as you intimated and displayed, you know, back in the older days before we had the vaccine, we had really hundreds of thousands, if not millions of cases of measles in the United States each year, resulting in thousands of hospitalizations, hundreds of deaths. And it really did have some very fearful complications with brain damage, deafness, and then the very unusual complication of the encephalitis that can develop even as much as a decade or more after infection. So this has been a disease that's been with us a long time. And unfortunately, if we let our guard down and we stop vaccinating, we will see more outbreaks like we're seeing today.
You know, before the show, you shared a quote with me that sounded to be about 100 years old from a famous professor of microbiology. And, you know, I thought our audience might enjoy that quote. Would you mind sharing it?
Yeah, thanks for giving me the opportunity, Dr. Gold. This is from a noted bacteriologist from America. His name is Hans Zinzer, and he lived from 1878 to 1940. And he's quoted as saying, "However secure and well-regulated civilized life may become, bacteria, protozoa, viruses, infected fleas, lice, ticks, and mosquitoes will always lurk in the shadows, ready to pounce when neglect, poverty, famine, or war lets down the defenses. And I'm afraid, unfortunately, what we're seeing is kind of a man-made problem with letting down our defenses against measles. There are communities where the vaccination rate is very low in our school-age children, and this is where we're going to see outbreaks ongoing in the future. I think this example in Texas is, very poignant of when we let down our guard. This virus is still lurking, and will come back.
And certainly there are parts of the world which do not have access to these highly effective and highly safe vaccines where, it's one airplane ride away and then it's sort of like striking a match into dry kindling and away it goes. I had mentioned earlier from one of the CDC recommendations regarding pregnancy and the need for vaccination. And perhaps you can just share some of your thoughts about why that's so important and what measles infection of mom is like during pregnancy and why it's so concerned. I remember even back to my own medical school days, which is a long time ago, that we were told that was a really important consideration.
Yeah, measles can be very severe, particularly for young children. It also results in some premature births for women who get infected during their pregnancy. In younger children, unfortunately, they do have a higher mortality rate associated with it, a higher rate of, again, the brain damage and the deafness and blindness that can sometimes go along with it. The measles vaccine is a live virus vaccine, meaning that it's a weakened virus that we want to be careful with how we administer it. And so typically immunosuppressed people, pregnant women, may not be eligible for the vaccine, but we want to make sure that we're giving it broadly throughout the population as widely as we possibly can in order to create, as you mentioned, that herd immunity that is so important. The vaccine is tremendously effective. So people who even get just one shot have a 90% or higher rate of protection against measles. And then what we found back in the 1980s was that there was rarely pockets of people who had received a single vaccine that could also then get measles. And so the recommendation changed to where now we're giving people 2 shots. So typically a child will get a vaccine at age 12 to 15 months. And then again, just before they reach school age, so when they're age about 4 or 5, they'll get that second dose. And with that second dose, the rate of immunity is 97, 98, 99%. It's amazingly effective. It's also quite safe, but just like any vaccine, it's not perfect. You can get a little bit of low-grade fever or arm pain where you get the vaccine, and under very, very rare circumstances, you can have a more serious allergic reaction. But again, the risks of getting vaccinated are so much less than the risks of getting measles and suffering all of those problems that we've already talked about, where now 20 to 30% of the people get sick enough to come into the hospital, and then about 3 per 1,000 or so actually lose their lives from the measles. And then a smaller proportion also go on, again, to have pneumonia, brain damage, all of those complications that are so feared.
Well, certainly, thank you for that wonderful explanation. And it's a bit scary, but I think it's also helpful to really understand what the science is. We're going to take a quick break. Our phone lines are open. We do want to hear from you. Please give us a call at 877-731-6733. And we'll be back in just a minute or two more with Dr. Rupp and talk more about the safety of vaccines and other infectious diseases that are now of interest to all of rural America. Thank you.
Many of my clients ask me, how can I afford to buy my next home, but also make sure my current home sells? That's why who you work with matters. With HomeLight, we're able to help clients buy and sell at the same time with all of the certainty and none of the stress. It's the most game-changing solution in real estate today. Together with HomeLight, we've helped clients win the home of their dreams every time.
This week's episode of Life on the Land starts in North Dakota, where a group of Hayden members get together for a pheasant hunting experience like no other. From there, we head to Montana's expansive Cross M Ranch, covering nearly 1,500 acres, before heading to Texas for an unforgettable duck hunt on the renowned Twin Creeks Ranch. We finish back in the field, wrapping up an amazing pheasant hunt with friends. Be sure to tune in this Wednesday at 8 p.m. Eastern on RFD TV.
On the next Wood Songs, it's Tennessee-based acoustic duo Wild Ponies.
Heartbeats next to mine. Heartbeats next to mine.
And all the way from Denver, Colorado, from Mount Kilimanjaro to the Woodsong stage, it's Megan Burt.
You can make believe that you
Fridays, 6 p.m. Eastern on RFD TV.
With kids still at home and a full-time job, taking care of Mom was becoming a real challenge. I was so grateful to discover Visiting Angels. Mom's Visiting Angel helps her shower and dress, and she keeps an eye on Mom's Alzheimer's. And our care manager gives me regular updates. Best of all, Mom has a trusted companion who cares about her.
Visiting Angels, America's choice in home care.
You're watching Rural Health Matters, and joining us once again is our very special guest, Dr. Mark Rupp. But our phone lines are literally lighting up with questions. And so why don't we go to Alabama and see what Aga's question or comment is. Please go ahead, and thank you so much for calling us this evening.
And thank you very much for giving me opportunity to speak with you all. And I want to thank you, both of you gentlemen, that you're helping the people. And my suggestion would be for Texas, if the kids and everybody who come from school, or even they need to wash their hands more often with soap and water. And that's my suggestion. And that's just one thing. I don't know much. I'm not a doctor. But I had a question, since you know some cardiology. These medicines, first they gave me at the VA hospital here in Birmingham, Alabama. They gave me some losartan, 25 milligrams. And after a while, then Dr. Patel over there, he told me that, look, don't take these. They're outdated. And then they started me on, let me see this. This here is, it says, what's the name of it? Okay, this 51 milligram is a SACUBITRN, 49 milligram from VA hospital for heart failure. I don't have heart failure. I mean, they just gave me this to just protect it. I guess that's what they should say. The medicine should say that to avoid heart failure, whatever. But it didn't say that. It says for heart. So it's 49 milligram of VALSARTAN. Valsartan, whatever.
Valsartan, right. Yeah. Well, Aga, first of all, thank you for calling. And, so overall, my best advice, of course, is that healthcare is local, and the care of your local practitioner, particularly a cardiologist who specializes in heart disease, is always good advice to follow. The good news is about heart disease, and, as some used to tell me, it's in my zip code. I spent a lot of years dealing with both adults and kiddos with heart disease, that there's really, really good diagnostic technology out today, whether it's an echocardiogram or a nuclear stress test, cardiac cath, PET imaging, MR imaging, and so many other things, that if people are having symptoms, either shortness of breath or chest pain, or their lipid profile is suggestive of high risk, or they have a family history that needs to be dealt with, there are really good diagnostic tests to measure the need for any medical intervention. And there are really good diagnostic treatments that can really help lower risk. And, over time, we have seen the number of heart attacks and the deaths from heart attacks go down in the United States. Unfortunately, we've seen the deaths from congestive heart failure go up. And so my advice to you, which would be my advice to anyone calling about their specific medications, is bring them with you, put them in your pocket, put the pill bottles on the table with your healthcare professional, and ask them to walk you through why these medications, what they're doing, if there's an interaction, and specifically what they're treating and what the evidence is for that treatment. So thanks so much for calling. So let's bring Dr. Rupp back into our conversation.
Yeah, Dr. Gold, I'd like to
perhaps
address just one of the things that our caller related, and that was, potentially preventing measles by having kids wash their hands. And although hand hygiene is very important in trying to prevent the spread of certain diseases, measles spreads via an airborne route. And so people who have measles, they cough, they sneeze, they distribute the virus in the air. And as we mentioned earlier, it is truly one of the most contagious illnesses that we know. And so washing your hands probably won't give you much protection against measles. This is a virus that can stay suspended in an air sort of environment for several hours after the infected person has left the scene. And so that's, again, one of the reasons why it is just so difficult to sometimes contain these outbreaks, because it's so infectious and it's spread via that airborne route.
So what you're saying is hand washing is a good thing generally, but not for measles. It won't prevent the disease. We have another caller. Please, Shirley, go ahead with your call. We'd love to hear your question or your comment this evening, and thank you so much for calling.
Thank you for taking my call. I'm 82 years old, and I don't remember whether I've had the measles or not. And if I have had the measles, am I still immune? And if I'm not sure, should I consider getting the vaccination? And also, has the timeline remained the same for getting COVID boosters? Thank you for these answers.
Two really good questions for Dr. Rupp, and it actually gets into an area I wanted to discuss with you as well. There are quite a few adults, particularly older adults, perhaps some live in senior living centers, and others that, have not been vaccinated for measles in decades and decades and decades. So I guess the question is there an age limit above which we would recommend a boost like we do for some of the other vaccines? And does a previous measles infection give you a lifetime immunity?
Yeah, Shirley, this is a great question. And people generally who were born before 1957 are regarded as having immunity to measles. And the reason for that is that prior to the introduction of vaccination, essentially everybody was exposed to the virus and contracted measles. Again, it's one of the most contagious diseases that we know. And so if you were born before 1957, it's very, very likely that you had measles as a child. And therefore, you don't have to get vaccinated at this point. You do have lifelong immunity from natural infection. And again, if you've received 2 shots, like we talked about earlier, that we started back in the 1960s and they're going forward, that those 2 shots are likewise giving people lifelong immunity. So that's what I would relate on that. If you really were concerned, you could get your immunity level checked with what we call a serologic study that would test whether your body carried antibodies to measles. But again, most authorities would say if you're born before 1957, you're probably protected. Now, with regard to the COVID-19 vaccination, as Dr. Gold presented in the early part of the program this evening, we do have some small shifts in what strain of the virus or the mutant of the virus is circulating. That really hasn't influenced the recommendations for vaccination. We'll be looking at those strains, formulating the new booster vaccine. And my guess is that recommendations will come out in the fall that you should go ahead and get your flu shot and your COVID shot at that time.
And do you think, Dr. Rupp, that will vary by age? For instance, I think some of the recommendations were individuals over 65 initially, certain comorbidities such as being treated for cancer or heart disease or lung disease, et cetera, as it has been previously.
Good point, Dr. Gold. And so for people who are at very high risk of COVID-19 and the complications associated with it, there are recommendations that you can get that booster every 6 months. I haven't seen anything that have changed those recommendations.
Shifting gears in just the last minutes of the show tonight, we previously reported a number of TB cases in Kansas and in other parts of the country that appeared to be a bit of a localized outbreak. Do you know whether that's been somewhat contained or whether we're still seeing spread, and if we need to be concerned about that? Because it's another, interesting change that we haven't seen in this country in a very, very long time.
Tuberculosis is extremely widespread throughout the world. We continue to see cases that get imported into the United States. Sometimes it can be a little bit tricky to pick up, and because people, will have cough and some wasting over a long period of time before the case becomes, evident to the doctors and to the public health officials. And by then, sometimes it's spread fairly widely within a community. That's what we've seen in this outbreak in Kansas. Undoubtedly, the public health system is working hard, and we'll get that situation under control as they go and they seek contacts and put people on prophylactic medicines and treat active disease. So we will get that under control. But again, tuberculosis does continue to have cases in the U.S., and we will see these outbreaks.
And if people are concerned, let's say they have some symptoms or they knew somebody or had some contact with somebody who is being treated, what is the best recommendation for them other than just to call their local healthcare professional, or is there specific testing that is being recommended now?
So as the public health services investigate the outbreak, they will try to identify those cases and identify the likely contacts of those cases. People who know that they've been exposed to tuberculosis can be evaluated. Initially, what would happen is the health authorities would try to make sure you don't have active tuberculosis, so they would screen you for cough and fever and whether you were coughing up blood or losing weight, those sorts of things, night sweats. If you had signs of active TB, they would work very aggressively to make sure that they define that. If you just had contact with a TB case, they would probably test you and then retest you again probably 6 weeks or so after the exposure. And if you had evidence of TB infection at that point, they would put you on what we call prophylactic medication to prevent you from developing active disease. I know that's a little bit complex, but the bottom line is if you think that you've had exposure or you're at risk, contact your health provider.
Well, I want to thank you so much for joining us again, Dr. Rupp. It's always a pleasure. And to our audience, if we didn't get to your question, please give us a call. You can reach us at 855-776-6147. Have a great evening, and remember, rural health matters. Thanks.